All right, good afternoon, everybody. We will get started. My name is Isaac Reichman. I'm the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. Today's presentation, today's webinar is the overview of the new regulations for retail. As you all know, just 2 days ago, Mayor Lightfoot and Health Commissioner Dr. Arwady announced an easing of the phase 4 restrictions for businesses, all types of businesses throughout the city of Chicago. And this applies again to all different types of industry. Today's webinar is going to be specifically for retail and the changes that are coming into effect as of tomorrow, October 1st. So a little bit of housekeeping before we get started. We had a little bit of technical difficulties on our last webinar. So I do want to ask you guys, just want to make sure to be clear from the beginning. If anything gets disrupted during the webinar and you have any questions that aren't answered, please send us an email at bacpoutreach@cityofchicago.org. Again, if you have any questions outside of this webinar, please email us at bacpoutreach@cityofchicago.org. During this webinar, you can submit your questions to the chat function, which is the place where I just typed in the email address. If you use the chat, you can submit your questions. So I ask that you do that, and I'll do my best to answer those questions. But if I don't answer every question, or if something needs follow-up, or if something's really specific to a specific business, please email bacpoutreach@cityofchicago.org, and we'll get you those answers as quickly as possible. Additionally, this webinar is being recorded, and it will be posted hopefully by tomorrow or the next day on our website at chicago.gov/businesseducation, the same place you went to in order to find this webinar. Additionally, you can find all of the guidelines, including those that are new and coming into effect tomorrow, on the reopening website, which is chicago.gov/reopening. So, I will get started. Here's what we're going to be talking about today. So we're going to be talking in total about phase 4, titled Gradually Resume, because we are still in phase 4. And as we said from the beginning, that we are, there's going to be changes kind of throughout phase 4 based on what the data says. And the data over the last month has shown us that we're ready to take this next step and to take this next step while we are still on our road and our path towards recovery. So I'm going to start by providing an update on the data. Then I'm going to provide some details on the changes to the phase 4 guidelines for a number of different industries. Then I'm going to specifically talk about the overview of the retail guidelines. Finally, I'm going to talk about enforcement and operational requirements. Again, I want to point you all to chicago.gov/reopening for all of this information. Everything you find here, everything you see here, you can also find there. So again, I want to make it clear that everything we do is based on the data. I am not the health department, unfortunately, so I will not be able to answer questions about why these decisions were made or what the health impact is of these decisions. So Business Affairs and Consumer Protection is the department that enforces the regulations, but we look to our health department and to our mayor and our mayor's office to determine what these decisions are. So they and we have been looking very, very closely at the health metrics dating back to the whole time, but dating back specifically to the beginning of phase 4. So as you can see on this graph here, when we entered phase 4, we were at below 200 cases a day. We have been gradually rising then from around the end of June up until the end of August. But over that last month, they have started to go back down. We're currently at about 300 cases a day, which obviously is not good enough, but is considerably better than what we were a month ago. So as you can see here in a little bit more detail, this is all of phase 4. What we did and what the health department did to determine that we were ready for this easing of restrictions was they set a number of different metrics and made sure that we were green, ready to go, ready to move forward in all of those metrics. So one of them was having stable or decrease in cases for at least 28 days. As you can see, that has been the case. You've been stable or going down for at least 28 days. Hospitalizations have also been stable or decreasing since August 27th, for greater than 28 days, which is again a sign, a very good sign that we are moving in the correct direction. Deaths, as you can see, have been way down since our peak back in April and May. We've been down really since the beginning of July, which is wonderful news, at about 3 deaths per day, still 3 more than we want, but that's been certainly stable or decreasing since June. Emergency department visits for anything related to COVID, any COVID-like illness, or whether or not someone has tested positive, also gone down significantly to about 45 emergency department visits for COVID-like illness a day. That's stable or decreasing since August 30th. Our test positivity has been under 5% now since September 10th. Our goal was to have that for at least 14 days, which means we're ready for moving ahead with some of these changes. We're at 4.3%, still higher than we were back in the beginning of July. However, still, again, very good news there. Hospital capacity throughout this crisis, but particularly since around the beginning of May, you can see we have significant and more than enough hospital capacity, which is, again, great news. Our goal is to be below 1,000 non-ICU beds. We're at 259. Our goal is to be below 400 ICU beds. We're at 89. And then below 300 ventilators, and we're at 45. Again, great news, good sign that we're ready to move forward. Finally, testing capacity. Really, ever since the beginning of June, we have been solidly over our goal of 4,500 tests per day. We're currently at a little over 8,000. You saw a little bit of a dip there during Labor Day week, but really happy to say that our testing capacity is where we want it to be. Which is all to say that we are ready for new regulations coming into effect. So effective tomorrow, October 1st at 5 a.m., we will have a number of different regulations come into effect. And now not all of these affect retail. However, we want to make sure that we are providing this information here, that we are providing you an overview of all of the new regulations. So first, increased indoor capacity. Capacity is increased from 25% to 40% with a maximum of 50 people in a room or space. So if you had been limited to 25%, you are now limited to 40% with a maximum still. If you were limited to a maximum of 50, you're still limited to a maximum of 50. So what does this mean for you? This applies to a number of different industries, including restaurants, health and fitness centers, personal services, performance and event venues, movie theaters, museums, indoor recreation, higher ed classes, faith-based services, and also non-essential retail. Essential retail has been at 50% and will stay at 50%. Non-essential retail will increase from 25% to 40%. Taverns will be reopening. Again, doesn't apply to folks necessarily on this call, but bars that don't serve food, breweries, taverns, places like that can now open indoors at 25%. Bars, restaurants, and other places that serve alcohol will now be able to do so until 1 and can stay open until 1:30. Group size for health and fitness centers and after-school programming will increase from 10 to 15 people max. And then expanded personal services, facials, shaves, and other personal services that require the removal of face coverings will now be allowed. So again, I wanted to provide an overview on all of the new regulations coming into effect. Then I want to take the next couple of minutes to provide a reminder and an overview of all of the different retail guidelines. Again, these are the retail guidelines that have been in effect, with the one key change for retail is that capacity is now limited to 40% for non-essential retail, where it was limited to 25%. So you can have increased capacity within your store. If you were non-essential retail, you were previously limited to 25%. You are now limited to 40%. So you should be providing 6 feet markers in any area where guests or employees queue or congregate to ensure appropriate social distancing. If 6 feet of social distancing is not possible, you should be providing impermeable barriers. Capacity, again, is limited to 40% for non-essential retail and 50% for essential retail. That does not include staff. Now, if you have any questions on how to calculate your capacity, please send us an email. This is something that our Department of Buildings can help out with. So if you have any questions, please send us on how to calculate capacity. Please send us an email to bacpoutreach@cityofchicago.org, and we'll help get you answers. Face coverings must be worn over the nose and the mouth. Hopefully this is something that, again, has been in effect throughout this time, so hopefully nothing's changing there. Grocers should have gloves following standard food handling protocols. Sanitizing products should be available for customers and employee use. Employees should wash hands before and after every service. Store employees are still prohibited from handling reusable shopping bags. And any store-issued clothing should be, so you should clean store-issued clothing that you keep in the store, clean it after every shift. And if employees bring it home, you should encourage them to clean it after every shift. You should be implementing screening measures for employees and customers. This means at minimum, prior to entering the establishment, employees should self-screen to ensure that they do not have symptoms of COVID-19, and they should not report to or be allowed to remain at work if they have symptoms or feel ill. That's the minimum. Now, you can certainly do more. Again, you can certainly do more than this. But at minimum, you should be self-screening. You can do temperature checks, things like that. Should be providing markers outside for queuing customers. You see these all over the city. You have people that are waiting to come in because they do not fit within the 40% capacity. Then you should be setting up markers outdoors. Have daily, at least once every 2 hours, you should be cleaning and disinfecting high-touch areas. Should be providing visual guidance for hygiene standards and entry requirements. You should be posting those throughout your facility. Cafeterias, buffets, other self-serve food stations, they can be open, but only if the employee serving the food if you have an employee serving the food and wearing proper PPE. Self-serve stations should be closed unless there is an employee serving it. If practical, you should be adjusting store navigation with one-way aisles, things like that, if it is practical for your space. You should be limiting in-person work wherever possible. Consider using online training, virtual staff meetings. If practical, allow employees that can work from home to continue to do so. We still encourage curbside delivery, contactless payment, self-serve checkout wherever available. If practical for full-service grocery, you should specifically, again, then for grocery, shopping hours for vulnerable populations at least once per week for 1 hour at the beginning of the day. We also recommend limiting staff travel across multiple retail locations. Again, limit travel across multiple retail locations so we have less mingling of folks. You should also be prepared for somebody contracting COVID-19. They should definitely follow all the CDC guidelines before returning to work, including cleaning it, and you also must clean and disinfect the workplace according to CDC guidelines. If any employee has had close contact with a coworker or anyone else who's been diagnosed with COVID-19, they should quarantine according to the CDC guidelines. And if you become aware of 2 or more cases possibly associated with an establishment over a 2-week period, we recommend that you report those cases to the health department. Now I'm going to open it up for a couple of questions. I do want to remind people that BACP has been and will continue to be enforcing this. Fines can lead to up to $10,000 each, and we also can and will close down establishments. To date, we've conducted over 2,000 investigations and cited 142 businesses. Now, let me be clear, most of these are response to complaints. And the fact that we've cited 142 businesses is only about 6% of the investigations that we've conducted. So I want to thank all of you for all of your hard work and dedication following all these guidelines. And I do want to remind everybody to not take your foot off the pedal here. Now it's time to double down on all of our enforcement and to make sure, to double down on our compliance to make sure we're truly following these guidelines. Now I'm going to open it up to see if anybody has any questions. I'm going to put this screen back up here as a reminder. Please, again, use the chat function if you have any questions. If I'm unable to answer it, please send them via email to bacpoutreach@cityofchicago.org. Got one question, are reusable bags permitted in grocery stores? We still should be prohibiting store employees from handling reusable shopping bags. So that is something that is not allowed at this point. And if you have any questions, please use the chat or please send them via email to bacpoutreach@cityofchicago.org. I don't see any questions coming in. I'm going to stay on for another couple of minutes, however, but I do want to again thank you all for attending this. If you have any follow-up questions, something that doesn't come up, again, this is being recorded. We'll be putting it on our website shortly. Any follow-ups, though, please do not hesitate to reach out, and we'll get you answers as quickly as possible. Thank you, everyone.